Hi everyone, in this video we are going to see about herpetic gingival stomatitis. The topics covered in this video are what is herpetic gingival stomatitis, how it is caused, the mode of transmission, signs and symptoms, diagnosis and treatment. It is a viral infection of oral mucous membrane caused by herpes simplex virus. It is of two types, HSV type 1 which predominantly affects lips, face, oral cavity and upper body skin. HSV type 2, it affects genitals and skin of the lower half of the body. The mode of transmission of HSV could be droplet spread, skin-to-skin contact, immunosuppression, unprotected sex. The incubation period ranges from 2 to 20 days with an average of 6 days before development of lesions. Now, let's see about the pathogenesis. The virus enters either by skin or mucous membrane, which leads in viral multiplication, causes lysis of cells, vesicle formation, which leads to ulcers. The general features of herpetic gingival stomatitis it is seen mostly in infants and children less than 6 years of old. It is also seen in adults. Mostly primary infections are asymptomatic. As part of the primary infections, the virus ascends through the sensory and automatic nerves where it persists as latent HSV in neuronal ganglia that innervate the site. Secondary manifestations result from various stimuli such as sunlight, trauma, fever and stress. The secondary manifestations include herpes labialis, herpetic stomatitis, herpes genitalis, ocular herpes and herpetic encephalitis. The oral signs includes diffuse erythematous, shiny involvement of the gingiva and the adjacent oral mucosa with varying degrees of edema and gingival bleeding. During its initial stage, it is characterized by the presence of discrete spherical grey vesicles which may occur on the gingiva, the labial and buccal mucosae, the soft palate, the pharynx, the sublingual mucosa and the tongue. After 24 hours, the vesicles rupture and form painful small ulcers with red, elevated halo-like margins and depressed yellowish or greyish-white central portions. These occur either in widely separated areas or in clusters where confluence occurs. The course of the disease is limited to 7 to 10 days. The diffuse gingival erythema and edema that appear early during the course of the disease persist for several days after the ulcerative lesions have healed. Scarring does not occur in the areas of healed ulcerations. Oral symptoms includes generalized soreness of the oral cavity which interferes with eating, drinking and oral hygiene. Ruptured vesicles are the focal sites of pain. They are sensitive to touch, thermal changes, foods, etc. In infants, it is marked by irritability and refusal to take food. The extraoral signs and symptoms includes cervical adenitis, generalized malaise, fever as high as 101 to 105 Fahrenheit. Diagnosis. It is established from patient's history and clinical findings. The HSV isolation by cell culture is the gold standard, sang smear, biopsy and serological test. The treatment for herpetic gingival stomatitis includes topical lignocaine for pain relief, acyclovir 15 mg per kg 5 times daily for 5 to 7 days, reduces duration of disease, halts the progression of lesions and reduces infectivity.